Taken this class before. Yeah, I knew there's half of you have taken this class before. Why are you here? Think you can learn more? Let me do a test here on you guys that have taken this before. Okay. How do you establish level of consciousness? How many people know and remember right off the top of your head, that quickly, what 4 questions you should ask? 1, 2, 3. Okay, so most people don't know. Most of them don't know. How do you tell if a person's bleeding inside? Or can you even tell that? See, people, how many raise your hands that have taken before can tell whether the person is bleeding inside about that quickly? Nobody? One person again. How about getting a health history? Getting a health history on a person, so you have all the things in a row. What word do you use to remember everything to ask? How many people remember? Nobody? Good. You people are in here for the second, third, or fourth times. It's worthwhile. This is so important to take this class once every year if possible. I learn things every time that I do this class. There's just so much to do. But if somebody, their life depends on what you do, is it important? We do. And how dangerous is motorcycling? We're going to talk about that in a few minutes. We're going to see. You see who affects not only the person, but his club brothers or her club brothers, her sisters. It affects the families. It affects for the rest of your life. And for us to know what to do is so super important. Is that dangerous? How many people can see the slides pretty well?
I can.
You can?
No.
Okay. Turn off the lights. Is Eric still here? Put them off and we'll make a decision here. I would rather have them on for better eye contact. Is that a lot better? Yeah. It is. Okay, they're off then. Thanks for, if you can't hear them back, or if somebody's too warm or cold or whatever, let me know, because we want this to be a good experience. Is that look dangerous?
Yeah.
How many people would do that? Yeah, I knew there would be a couple of people in here to do that. I want this video to play. How many would ride that road? Yeah, a few people would, wouldn't they? Yep. Look over the side here, look down. That must be quite a kick, huh? Okay, when we take a look at fatalities, this is per billion miles driven, and this is a 4-year test. So statistics can always be changed. We know that. But take a look at this, and billion miles, and let's say that they're wrong, and that they're only half right, okay? So we'll all agree on that. But if they're right, you're about 27 times more likely to be killed on a motorcycle as you are in a car. So are we going to have more crashes? Probably, aren't we? And we live the lifestyle that we love, absolutely love, is sure a dangerous one. But learning what to do not to crash and what to do if somebody does crash is pretty important. I've done a lot of research and I found out the main problem, and it's not fastened to the handlebars. I'll tell you what, that's us. And there's things that we think about here that are different. But you look at this, and a good friend of mine, Lane Triplett, does anybody know Lane from Idaho? Yep, one person in here, he's right on, isn't he, Charlie? Yep, and he's one of us, so he's not going to skew these figures. This is Idaho statistics. And you look at this with single vehicle crashes, 60 of them are rider error. And we say that isn't true, but I've checked in a lot of other states, and this is pretty much right on. So the blue-haired old lady that pulls out in front of us may happen sometimes, but when you look at this, and I divided that out, that's 89 point something. It's 90% of his rider error in fatalities for single vehicle crashes in Idaho. You say, well, what about multiple crashes or vehicle crashes? You look at that, 60% of those are our fault. Over half. So us learning what to do, and how many people take a rider's course every year? Good. We got a couple people. We all should take a rider's course every year. Because you look at rider error and how important that is to know, and it's our fault most of the times. I want to talk about insurance just a little bit, because it's so doggone important, and I put this in because I think it's so important. And I want to talk about uninsured, underinsured riders. This is my up for my bike, and you take and you look at this, $500,000 each person, $1 million. And that's if it's somebody else's fault and they don't have enough to cover, or the other one is underinsured. So you take it, you look at them, then, so you got, I upped this. For another $10, I got it, so I got $1 million coverage. This is if it's somebody else's fault and they're uninsured or underinsured. Okay, now we got $1 million. If I'm riding with my bike alone and something goes down on, if it's somebody else's fault and they can't pay for it. How many people think there's a lot more people driving with no insurance or underinsured these years now? Boy, yeah, and everybody knows that. Lots more people driving that. And even if we're completely right, we still end up with the bad end of the deal, don't we? Now let's take a look down here, and we're going to insure the bike. And you look here, you say it's worth $28,000, and you want comprehensive and collision, and you pay $174. And if we all lost $28,000, we'd feel pretty bad, but it sure wouldn't bankrupt us, would it? But you look at the other, if you had insurance or did not have insurance, and for $21, $31 now for me for $1 million coverage. $1 million coverage, I paid $31. Hey, does that make sense? It sure does, doesn't it? Who's going to end up on the short end of the stick at any car, vehicle, motorcycle crash? And I know this doesn't pertain quite what I'm talking to, but I feel so strongly about this, I put it in a lot of my different classes here. Talk to your insurance. They aren't going to push this, but this is a bargain. And we hope before that. We've all spent $30 at a bar. Skip one night and you got up to $1 million, baby. And this, when I changed it to $1 million, then 500,000 before, changed it to $1 million. Now, passenger, if they're $100,000 hurt, I can collect $900,000. So you see how important and how it is, how smart that is. How many know whether they even have uninsured, underinsured? How many people know? Oh my gosh, over half of you don't know. Wow, that's really something, isn't it? Check out, that was worth your trip here, and I hope nobody ever needs that, but we need to think about that, don't we? Are people getting smarter? drivers around us? How many people have been riding 50 years? Good. You think they're getting better or worse? Worse, yep. Like this, are they thinking about us? That guy in the swimming pool jumped right out in front of me. You ask your kid, where's the car? You aren't going to believe this one, Dad. You aren't even safe in a gas station. Things can happen, can't they? We're going to talk about the golden hour. What's done in that first hour, a lot of times will make a difference between life and death with a person. We need to be thinking about that and know what to do to help somebody that goes down. Okay, you see the white piece of the pie there? That white piece of the pie is up to us. That's how many people think that this is logical that an ambulance can be there in 5 minutes? Okay, let me ask you this. How many people think if you could get a critically injured patient to the hospital a half an hour quicker, that would save their life? Absolutely, we both all know. How about 15 minutes? Yep. How about 5 minutes? How about in some cases 1 minute? In some cases it could be, couldn't it? And you look at this, and this is what we're going to be talking about this afternoon. The white piece of the golden hour. The piece where we are there. Question?
If you're in Detroit, the EMS won't come until the cops are there to secure the area.
Yeah.
Same thing with the fire department.
Yep. It's different in every place. I do realize that. But anyway, we want to shorten this white piece of the pie. Sometimes the ambulance won't get there for a half an hour, like he was mentioning, you know. But if we have everything ready, it's our job to shorten versus so they can load and go. And what we're going to be talking about this afternoon is how to manage that. Okay, is the person urgent or not urgent? If we don't know, let's treat them as urgent, okay? And if we're wrong, and we hope we are, but you know, if we don't treat them as urgent, when we don't know how bad they're hurt, that can make the difference between life and death, couldn't it? Remain calm. Everybody knows that, don't they? You should remain calm. I run ambulances for 20 years, volunteer out of Royal Fire and Rescue. And you know what? When an ambulance pulls up and you're lying there hurt, and a guy gets out of the back, he's got his little bag, he's got his fancy EMS thing on, and he comes, oh my gosh, oh, look at Bill's leg. Oh man, we'll never say that leg. You'd be lucky if you live. I don't know, get the gurney get the gurney over, he's really hurt bad. Hey, what happens to your credibility there? And you say, that can't happen. Well, I'm seeing lots of accidents, and people panic. You know? And if you're the one that's supposed to be in charge and you panic, it just spreads out to remain calm. Introduce yourself. Let them know that you've taken a class. I've had a class that I know what to do, and I'm here to help you, and the ambulance is on the way. Psychological management, you know, if that's you, you go, oh my gosh, somebody's here that knows. You know, psychological management is really, really important. Introduce yourself. How important that is, and you might do that different times during the time period. I worked for a long time on the ambulance, and I've been mistaken one time for the devil. Another time I was mistaken for Jesus. Another time I was for a doctor. Another time I was mistaken for the Cowardly Lion from the Wizard of Oz. That's why you introduce yourself, you tell them that you are here to help and you know what to do. Just that in itself will make a difference sometimes. Think back to what you learned today. Everybody should know what to do. Remaining calm and thinking maybe you take 2 deep breaths, say, gotta keep it together. Gotta calm down. And then you go on with the stuff that we've learned today. Don't panic. You're the first on the scene. We're going to say what you've learned this afternoon will be the highest training level that there's there. And you're the most important person in that injured person's life at this time. It's a big deal. Assess the situation. Is it safe? Or are you just over the crest of a hill with a lot of traffic coming? I'm going to tell you not to move the patient, but there's sometimes we have to. I'm not telling you what to do today, but I'm giving you a lot of tools for your toolbox. And take those tools and then you have to pick out what to use. Because I've never been to a motorcycle crash where it's been exactly the same as another one. So your field decision is a big deal. Don't move the patient. We talked about that. Help her at all. Sometimes just a small amount of lateral movement will maybe sever something in a person's spine. It's so important when we've been really, really knocked around, not to be jostled around. You can go into shock from being handled roughly. That's something? Yeah. So it's up to us. Send the female to the door. Tell you what, stand up with me here. Here. You trust me, don't you? Always? Okay, stand up, please. Okay, look at these two. Which one would you let in your door? You bet. Yep, you're going to pick a good-looking lady all the time. You're out. But you will have to say some time for the golden hour. You say, Slider, we have cell phones now. I know not several, but maybe 4 accidents last year where they weren't in a cell phone area. This is out in the Black Hills. So sending the female up to the door and you holler in there and you knock and say, there's been an accident, would you call for an ambulance for me? And then they'll probably let you in when they look out. They see him, and they're going to call the police. Yeah. What's that done for our part of the golden hour? That white piece of the pie has made it longer needlessly. But sending a female to the door, if you have to do that, is pretty important, isn't it? There's been an accident, a crash. It's not a medical emergency as far as diabetes or something like that, but we know that with our age group that maybe that crash was caused by a possible medical problem. Number of injured. Let's say that we have 5 people injured, and I look out at these 5 in my quick assessment to see whether it's urgent or not. Remember, 3 of them aren't even moving. They're unconscious. Another woman has got her femur stuck through her. It's called a compound fracture, sticking out of the skin in her leg. And she's screaming. The other person is trying to get up, but his leg buckles every time he tries to get up. And he's yelling and hollering, where's his wife? Are the 3 people who are unconscious? Are they in priority? You bet. How about the person with a finger sticking out of his leg through the skin? That's definitely a medical, that's definitely an emergency, isn't it? And how about the person that doesn't quite know where he's at? Do we have 5 patients that are potentially critically injured? Okay. And how many people will one ambulance take care of? You've got her. How many ambulances do we ask for? 5. What if you're wrong and only need 4? You're going to really feel shitty then, aren't you? Absolutely not. You're taking care of your part of the golden hour for that person that we want to help. It's a big deal. It's a big deal. Okay, location of the accident. Have nervous people ever given the wrong directions? They sure have, haven't they? And what's our job today? Learning how to take care of our piece of the pie, the golden hour, right? So, if I have enough people, will you go down to this next corner? This is a gravel road out in Iowa. Will you go down to this next corner and wait for an ambulance? Okay, Charlie, will you go with him? Okay, and let's say Charlie knows some other people there, and you don't. So pick another 2, 3 people. I'm going to put you in charge, Charlie. get this lined up, and so we get the ambulance out of the right way in. So Charlie will go out there and he'll put somebody at the bench where you're turning to that corner, and then he'll put one down that section and one over here, whichever way he thinks the ambulance is coming. You don't know which way the ambulance is going. He's going to put a person here and a person there. Get it? Not hard. You gotta have enough people to do that, but can that save 10 minutes of the golden hour possibly? And I know, man, I've heard when we was cheering in with another ambulance, you hear the ambulance a mile north of us, I can still hear it going, I can see the lights flashing, but they were off a mile. If I would have had enough people, you see what that would have done? Is that gonna save somebody's life all the time? Sure, it's able to save a person's life sometime, isn't it? So that, if we got enough people, that's what we're gonna do. Okay, and you're talking to dispatch, right? On the 911. And you go through and you tell them, they have a little book that they thumb through and tell you what to do. You tell them where the accident, you give them directions, you tell them that there's 5 people down, 3 of them are unconscious, one's got bones, you know. So that, what's that gonna do when you let them know? What's that dispatch gonna do? She's gonna send 5 ambulances, but you know what else is gonna happen then? In a town like Spencer, Iowa, where I'm close to, they're gonna call for x-ray techs. They're gonna bring in a couple more doctors. They're gonna get some nurses. They're gonna get the oxygen set up and ready. They're gonna get all this stuff ready. And what have you done for the golden hour for that person who's just doing that? Maybe you save 5-10 minutes, maybe more. And all you gotta do is remember to tell them. Okay, you've told them how many people are down, you've given them the directions, do you hang up then? No, you stay on that phone until dispatch ends up. Different parts of the country handle this differently. A lot of places they'll want you to stay on the phone with dispatch until they get there. And why is that so important? My gosh, there's one person that was down and unconscious, and we got plenty of help there. And remember, we checked airway, A, B, breathing, C, circulation, and C, cervical spine injury. Looking for that. And one of those people, when we're checking, just quit breathing. So CPR is in progress. Got it? Okay. Do you think that's important for the ambulances to know coming? You bet. So you either call back or have it turn on. And delegating too. If you're good and you've got a background in trauma and that, you give it to your phone and let somebody else talk. So you can get it and then you may take charge of this whole works. And just like when those videos come on of people going down, it happens that quick. See, you weren't expecting that, but if this was real life, you would have to act right away. Pretty important thing. Write everything down. Got Jane sitting over there. Jane, will you take and write everything I tell you down so we keep track of each patient? Sure. Okay, so she's going to write this. I don't have to worry about that. Okay, it's time. What time is it now? They just went down. Got that written down, Jane? Yep. So the time when the golden hour starts is written down. Safety factors. Is there traffic coming over the hill? Where are you at? Hazardous material spills? You know what? A motorcyclist, how many motorcycles do you see that are standing up after a bad crash? Not very many, do you? So you automatically assume, in my book, what if you're wrong, but there's a gas spill, there's going to be a gas spill. So we got gas, and that will trigger fire department, or you ask for fire department if you see gas on the ground. Or maybe even if you don't, you ask for fire department. They'll come in, those guys can foam everything down, you know, for fire. It's really important. Could be a power line down. Safety circle. If I just take you guys here in the front row and you 3 here, take a look at these guys. If I put them down and the person is down on the ground right here, and we have plenty of help like that, and I put them in a circle, semicircle around there, who's going to get into that patient? Only the people we want in there, right? And people want to see, for some reason, it's human nature, they want to see blood, guts, and gore, except until they see it. And then some people can't get that out of mind for the rest of their lives. But we get a safety circle. What if you come and you're a nurse? You work in a hospital, are we gonna let you in that circle? Absolutely. You bet. And another person comes and you say, I'm a paramedic, I'm off duty. Hey, we've got a couple pretty good people to put in there, don't we? It's really good. But sometimes people that work just in a hospital aren't really adapt to working in the ditch and in the field. You know, they're used to everything in the hospital, everything's sterile, everything ready to go. You know what I mean? So sometimes maybe a paramedic would be of more use in the field than a nurse. And not just putting nurses down, that's for sure. But sometimes we need to maybe pick that. Are we paying attention for our own safety? Where are we still focusing on? We're focusing on this person right here that's down, and we aren't watching for traffic. So being in charge of traffic, I might take 4 guys and say, go way down the road. When you tell people to slow traffic down, for some reason, they go 300 foot down the road, and then, you need to get clear down there. And you might need to put people 2 or 3 deep, you know, one there, one here, and then one there. Everybody knows out of it. You got 3 people flagging you down, you better be slowing down. Because our safety, no matter what so you know everything. When we get injured, it's not the way it should be, is it? So that traffic control sometimes is just about as important as putting a good medical person on the person that's down. Competent person may be in charge, needs to be in charge. Today, just for the sake of the seminar, you are the most important person and you are in charge. You say, man, I don't know hardly anything, Slider. I shouldn't be in charge. Well, you're the only person there and you'll have to take over and you'll have these other people to come, you know? So you keep calm and you think. And you know what about that? And we say this person is unconscious. They're unconscious. They can't hear. You know what? They still haven't figured this out. But the subconscious mind, which is about 98% of the mind, they don't know how this works, but it still filters in. And you say, my gosh, this person, they don't stand a chance. They're unconscious. They can't hear. Hearing is the last thing to go. You don't want to tell them that negative things. What you want to tell them is, in their ear, I'm here to take care of you. I know what to do. You've been in a motorcycle accident, because you don't know that. I've interviewed all kinds of people that have been in bad ones, and they don't remember it. If you tell them you've been in a motorcycle crash, the ambulance is on the way, I'm going to be taking care of you. Is that better to hear psychologically than that guy will never make it? Really important thing. Our mind works so different that we really can fathom that it's just mind-boggling. I'm just so interested. Remember, the brain has 100 billion neurons in it. Electricity is traveling at about 365 miles an hour. Man, don't be using that. Give them positive feelings, even if they are unconscious. Tell them the ambulance is coming, you know, feed that into them. Was qualified. I had one not too long ago. For some reason, I come on a lot of these things. But I come on one and I put people to work, you know, and I put one gal just back stabilizing the patient's head. And I found out later that here she was a nurse. And the person that had taken respirations and blood pressure, that type of thing, was a layperson. I should have been switched around. You know, from now on, I ask, do you have any medical training, rather than just put something to work? And what happened? I can give you different instances of this. You know what that woman said? When the patient went away, and I got to take care of the whole works, even I knew everybody on the different ambulances that showed up. But I got to take care of that person. And you know what that nurse said to me? When the ambulance pulled out, and I was trying to ask him, sir, are you a doctor? You see, doing just what we learned today make a difference, and people won't ask that question if they don't think, you know, that's right. Is that good for our force, us, with a brother's life or something like that? We really want to save that person? Important stuff. Learn basic life support. How many people know CPR in here? Wow, that's really impressive. Good, good. How many people that know CPR, or how many people in here know the percentage of saves in a trauma code? 0.5% we save in CPR on somebody whose heart stops and they stop breathing. So if I'm lying there and somebody young is lying there and I don't have a pulse or I don't have any respiration, do we need to think about that? Because if only you were there, you're going to have to make a field decision, and it will probably be for the younger person. If we got really good CPR people there and stuff, but nevertheless, trauma code, you only save half, so you don't, 1 out of 200. So it's something to try to think about. So that CPR in some situations is probably not worth the time. It's not a priority. It's okay if you got enough people to go around. Unresponsive, we have the airway, trauma, jaw thrust, if you all remember that from your CPR training. Breathing, how many times is the breathing event? Circulation, stop major bleeding. Sometimes they're moving that up now to first. It depends on the situation. If you're doing CPR and the blood is squirting out of a femoral artery, that's when you gotta stop that blood loss. And this is so important. This is what I carry, and Duffy from Iowa, the head person, stick your hand up, Duff. There's a good man right there. But anyway, he picked this up for me. He's taking the stop the bleed class also. In here is a tourniquet. There's gauze to stuff into the wound. It's got all the stuff here, plus it's got, we want to take the pulse and respiration and stuff, and you know that, don't we? Stick your finger on. This is called a pulse oximeter. And when you're looking for the pulse and trying to find it in the field, even if you're good at finding the pulse, it's kind of hard, you know what I mean? And when you're nervous like that, maybe it's there and you don't even find it. But when we're looking at this, there, I put this on your patient's finger, and it doesn't take very long, and I'm going to get an oxygen saturation rate of the red blood cells, and I'm going to get pulse rate. Okay, wow, you're nervous, aren't you? It's up to 93, it's good. His pulse is 93, and his blood oxygen saturation is 97. Man, is he in good shape? He sure is, isn't he? I'm worried about his heart rate a little bit. But you know what? I got something that I don't have to count. You can have human error. And these cost like $30. Pick one up and put it in your bike. Really important. This cost me, they paid $80 for it, and he got it to stop the bleed class. But in this is a tourniquet and also material to stuff the wound. You don't put direct pressure on an open, gapping wound. You need to stuff it. And this is a coagulant in this stuff in here. So it's stopping the bleeding there. Plus, then I also carry some maxi pads and some other stuff I put together and some tape. I got a trauma shears in here, that type of thing. So you see, when we're talking about, and the reason I'm spending more time on this, in the field, more people die from bleeding to death than any other cause. And I'm talking about in first. So our job definitely should be to remain calm and think, and if we got this kind of equipment, pack that wound, and then who do I put on? Put direct pressure on there. Do I put a small gal on that? Or do I put the gentleman from Florida here on that? Look at his size. Are they going to like that when he puts direct pressure on there to stop the bleeding? They're going to not like it at all if they're conscious, are they? But that's what we have to do, whether we like it or not. In there's a tourniquet also. It's like your belt, only it has Velcro around so you can pull the Velcro down and then you take and twist it. Everybody says, oh, you can use your belt in your pants or yeah, you can, but this is so much better. Charlie? How much blood can you lose before you die? It depends on whether you're a big man or a small baby. 30 milliliters on a little baby is blood loss to be worried about. Difference in people, and the human body has about 5 liters of blood in it. So I don't know, 5 quarts, is that right? 4 quarts, 5, no, it's 5. But anyway, when you lose like 20% of that, see, then you're going to become unconscious and stuff. If I knew an exact answer, I'd give it to you, but I can't tell you exactly. I don't know for sure. Cervical spine immobilization. Every motorcycle crash, even one, I know of this one, the person stopped at a stop sign, had saddlebags, the tour pack, everything. Him and his wife both had helmets. He put his foot down, and it was loose gravel, that kicked out. He went over, she hit her head and broke her neck, and she died. So when you're looking about that, cervical injuries in motorcycle crashes, always consider that we have a cervical spine injury until proven otherwise. Stop the bleeding. Direct pressure, clean cloth. Okay, you're out there, you don't have a clean cloth, and we know more people lose peripheral from infection than they do